Several herbs and supplements have been studied for their potential to alleviate symptoms of depression or improve mood. It's important to note that while some people may find these herbs and supplements helpful, they should not replace professional medical treatment or therapy for depression. Always consult with a healthcare provider before starting any new supplement regimen, especially if you're already taking medications or have underlying health conditions. Here are some herbs and supplements that have shown promise in reducing depression symptoms. St. John's wort, Hypericum perforatum. St. John's wort is one of the most researched herbal supplements for depression. St. John's wort, Hypericum perforatum, is an herbal supplement commonly used to alleviate symptoms of depression. Research suggests that St. John's wort may be effective in treating mild to moderate depression, possibly due to its ability to inhibit the reuptake of certain neurotransmitters, such as serotonin, dopamine, and norepinephrine. These neurotransmitters play a crucial role in regulating mood and emotions. Additionally, St. John's wort contains compounds with anti-inflammatory and antioxidant properties, which may help reduce inflammation and oxidative stress associated with depression. While St. John's wort is generally well tolerated, it can interact with certain medications and may cause side effects such as gastrointestinal upset, dry mouth, and photosensitivity. Consulting with a healthcare professional before starting St. John's wort is recommended, especially for individuals taking other medications or supplements. Omega-3 fatty acids. Omega-3 fatty acids, found in fatty fish such as salmon, mackerel, and sardines, as well as in flax seeds, chia seeds, and walnuts, have been extensively studied for their potential effects on depression. These essential fatty acids play a crucial role in brain health and function, and research suggests that omega-3 supplementation may help alleviate symptoms of depression. Omega-3 fatty acids have anti-inflammatory properties and may support the production of neurotransmitters involved in mood regulation, such as serotonin and dopamine. Studies have shown that individuals with depression tend to have lower levels of omega-3 fatty acids in their blood, and supplementing with omega-3s may improve mood and reduce depressive symptoms. While more research is needed to fully understand the mechanisms underlying omega-3's effects on depression, incorporating omega-3-rich foods into the diet or taking supplements may be beneficial for individuals struggling with depression. Saffron. Saffron, derived from the Crocus sativus flower, has gained attention for its potential antidepressant effects. Research suggests that saffron may be effective in reducing symptoms of depression, possibly due to its ability to modulate neurotransmitter activity and enhance serotonin and dopamine levels in the brain. Saffron also contains compounds with antioxidant and anti-inflammatory properties, which may help protect against oxidative stress and inflammation associated with depression. Several clinical trials have demonstrated the efficacy of saffron extract in improving mood and reducing depressive symptoms, although more research is needed to fully understand its mechanisms of action and optimal dosage. While saffron is generally considered safe when consumed in culinary amounts, individuals considering saffron supplementation should consult with a healthcare professional, especially if taking other medications or supplements. SAM-E, S-adenosylmethionine. S-adenosylmethionine, SAM-E, is a compound naturally produced in the body that plays a vital role in various biochemical processes, including neurotransmitter synthesis and methylation reactions. SAM-E has been studied for its potential antidepressant effects, with research suggesting that it may help alleviate symptoms of depression by increasing levels of neurotransmitters such as serotonin, dopamine, and norepinephrine in the brain. Additionally, SAM-E has anti-inflammatory properties and may modulate gene expression involved in mood regulation. Several clinical trials have demonstrated the efficacy of SAM-E as a treatment for depression, particularly in individuals who do not respond well to traditional antidepressant medications. While SAM-E is generally considered safe for short-term use, long-term safety and optimal dosage require further investigation. Individuals considering SAM-E supplementation should consult with a healthcare professional to determine suitability and dosage. Rhodiola rosea. Rhodiola rosea an herb native to mountainous regions of Europe and Asia, has been used for centuries in traditional medicine to combat fatigue, enhance mood, and reduce stress. Research suggests that rhodiola rosea may have antidepressant effects, attributed to its adaptogenic properties, which help the body adapt to stress and maintain balance. Rhodiola contains compounds such as rosamin, salidroside, and polyphenols, which have been shown to modulate neurotransmitter activity, reduce inflammation, and enhance neuroplasticity in the brain. Several clinical studies have demonstrated the efficacy of rhodiola rosea in improving mood and reducing symptoms of depression and anxiety. While generally well tolerated, rhodiola may interact with certain medications and cause side effects such as insomnia or gastrointestinal upset in some individuals. Consultation with a healthcare professional is recommended before starting rhodiola supplementation, especially for those with pre-existing medical conditions or taking medications. L-theanine. L-theanine, an amino acid primarily found in tea leaves, particularly in green tea, has gained attention for its potential benefits in reducing symptoms of depression and anxiety. Research suggests that L-theanine may exert its effects by modulating neurotransmitter activity, particularly increasing levels of gamma-aminobutyric acid, GABA, and serotonin in the brain, which promote relaxation and mood stability. Additionally, L-theanine has been shown to reduce cortisol levels, the stress hormone, and attenuate the physiological responses to stress. Several clinical studies have demonstrated the efficacy of L-theanine in improving mood, reducing anxiety, and enhancing cognitive function. While generally considered safe, L-theanine may interact with certain medications and cause side effects such as headaches or gastrointestinal discomfort in some individuals. Consulting with a healthcare professional before starting L-theanine supplementation is recommended, especially for those with pre-existing medical conditions or taking medications. Vitamin D. Vitamin D, often referred to as the sunshine vitamin due to its synthesis in the skin in response to sunlight exposure, plays a crucial role in various physiological processes, including mood regulation. Research suggests that vitamin D deficiency may be associated with an increased risk of depression and other mood disorders. Vitamin D receptors are found in areas of the brain involved in mood regulation, and vitamin D is involved in the synthesis of neurotransmitters such as serotonin. Additionally, vitamin D has anti-inflammatory properties and may help regulate immune function, which can impact mood. Some studies have shown that vitamin D supplementation may improve symptoms of depression, particularly in individuals with low vitamin D levels. However, more research is needed to fully understand the relationship between vitamin D and depression and to determine optimal supplementation strategies. B vitamins. B vitamins, including B6, B9, folate, and B12, play essential roles in brain health and neurotransmitter function, making them crucial for mental well-being. Research suggests that deficiencies in these B vitamins may be linked to an increased risk of depression and other mood disorders. Folate and B12 are involved in the synthesis of neurotransmitters such as serotonin and dopamine, which regulate mood, while B6 is necessary for the conversion of amino acids into neurotransmitters. Additionally, B vitamins play a role in methylation reactions, which are important for gene expression and cellular function. Supplementing with B vitamins, particularly folate and B12, may help alleviate symptoms of depression, especially in individuals with deficiencies or impaired absorption. However, further research is needed to fully understand the relationship between B vitamins and depression and to determine optimal supplementation strategies. It's important to approach herbal supplements and vitamins with caution and to consult with a healthcare provider before starting any new regimen, especially if you're already taking medications or have underlying health conditions. Additionally, it's essential to use high-quality supplements from reputable sources and to follow recommended dosages to minimize the risk of adverse effects. If you want to know more about mental health issue, worrying, anxiety, and stress, check out our other video about it. If you like the video and find it informative, subscribe, like, and share the video so it can help us do similar videos. In the description below, they are links that might help you work on reducing your anxiety, stress, worries.